Hi friends, today I'm going to speak to you about polycystic ovary syndrome. Many women suffer from polycystic ovary syndrome. The incidence in India is anything around 10 to 15%. In my own OPD, at least one third of the clients who I see every day are suffering from polycystic ovary syndrome. Then, knowing that you're suffering from PCOS is not adequate. You have to know what is spoiling your polycystic ovary syndrome. PCOS is a normal variation which exists in our community. Like a lot of us have spectacles. Doesn't mean it's a big disease or something. So PCOS is not some big disease, but there are spoilers. There are markers in polycystic ovary who are spoilers, who could be making your life difficult by giving you more excess hair, could be increasing your menstrual cycle durations, or trying to getting pregnancy more difficult. So as soon as a PCO client comes to us, once we make a diagnosis, we first sit and tell the couple exactly what is PCOS and what is the pathophysiology taking place there. We tell them about anovulation, which is a good hormone, which is a bad hormone, and how a bad hormone accumulates and how it can spoil the whole scenario. Once they understand what is the endocrinological problems, then we tell them what are the markers. So we investigate their anti-Mullerian hormone or AMH, their FSH, their LH, their insulin, their HbA1c levels, their thyroid levels, and obviously their weight and body mass indices. And then we identify what is the spoiler. We also do a sonography. A very thorough sonography is done with a 3D to know the number of antral follicle counts that exist. And we classify, is this client a very high AMH and that's why her PCOS is bad? Or is this client very high weight and that's why her PCOS is bad? And this classification or this stratification, depending upon the investigations and the complaints of a PCO lady, is very, very important. For example, for somebody who is, let's say, 75 kilograms of weight, but her AMH is maybe 4 or 4.5, her LH-FSH level is normal, and she's pretty young, less than 32 years of age, just simple weight reduction by 10% can give her a pregnancy. On the other hand, the same 75 kg lady who has an LH level of 30 and a cycle length or duration of cycles is about 2 or 3 months, that means she gets cycles only after 60 days or 90 days. Even if she reduces her weight, her cycles will become regular, but LH being high, her pregnancy may not be very fast, or she may be still resistant. Similarly, somebody who has a very high AMH, the AMH beyond 10, but she's a very thin, lean client. In spite of she being thin, we don't tell her to reduce weight further, but she is a difficult polycystic ovary because her AMH is very high. And can we do something to decrease her AMH? And that's laparoscopic ovarian drilling or something. So what I want to convey you that every PCO is different. If you're suffering from PCOS, see to it that you've investigated all the factors and you have discussed amply with your doctor what is your spoiler and is that spoiler modifiable? Can you correct the spoiler so that your chance of natural pregnancy will go up? As I understand polycystic ovary, there are ample number of eggs. The eggs are not developing. As you grow older and older, your number of eggs are going to come down, and your chance of pregnancy as age advances is going to improve. But can you modify a parameter now so that your chance of pregnancy even now can improve? And that's what I mean by a thorough consultation of polycystic ovary syndrome. If you want to know more about polycystic ovary syndrome, you're most welcome to catch on us at following numbers. Thank you.